Good morning and welcome to the third webinar in our Emergency Preparedness Network webinar series on COVID-19. Today we're going to discuss understanding N95 and other respiratory fit testing for home care. And we're pleased that we're going to have Dr. Roy McKay with us as our speaker. Excuse me for just a minute. Okay, so now I'm Dr. Charlene Brown. You're going to see me in all of these webinars. So for those of you that are watching multiple webinars, it's great to see you again. I'm the CEO and founder of Learn Care Together. I'm a preventive medicine physician and have been working at the intersection of senior care and workforce for several years. And before that, I spent my career focused on public health and infectious diseases with a special focus on pandemics. This webinar is brought to you by the Office of Preparedness and Response. That's part of the Maryland Department of Health. We are grateful for their sponsorship. The Maryland National Capital Home Care Association, lovingly described as MNCA, and Learn Care Together, LLC. If you want to learn more about EPN or to join the EPN mailing list, just go to the website listed right here. And for MNCA, if you're a home care agency in Maryland or in the Washington, D.C. area, this is the professional association for you, so just reach out to learn more. And again, a special thank you to the Office of Preparedness and Response for supporting and launching this series. We have more webinars on the docket. So next week, Dr. Cliff Mitchell will be talking about COVID-19 and chronic conditions at home, looking through two lenses. We're excited to have him. He's with the Maryland Department of Health, director of the environmental health section. And I think he's really gonna break down how to think about managing chronic conditions at home for those of you delivering care in the home, but through the context of the COVID-19 pandemic. On August 3rd, Barbara Citarella is going to talk about COVID compliance audits and after-action reports. While not formally part of this series, we're excited to have her. On August, excuse me, so sorry. On August 20th, Dr. Beth Gallick from University of Maryland will talk about dementia symptom management under lockdown. And we have many more speakers on the docket coming soon. So why are we discussing N95 respiratory fit testing with Dr. McKay? Well, I reached out to my network when Dawn Seek, who's the executive director of MNCA, told me that she had gotten a lot of inquiries about fit testing and N95 fit testing. It became clear that for a lot of home care agencies, especially private duty home care agencies, this was the first time they were going to have to really think about N95 respirator fit testing. And so I reached out to my network, and over again, people told me that Dr. Roy McKay was the person to reach out to. He's a national expert on respiratory fit testing and has more than 40 years of national and international experience of respiratory protection as a faculty member at the University of Cincinnati. He has a luminous career, has been the past chair of the committee responsible for the guidelines that we all follow on respiratory fit test methods. He was part of the committee that published the American National Standard Practices for Respiratory Protection. He serves on the respiratory protection of the American Industrial Hygiene Association, and he personally conducts respiratory fit testing in a variety of worker training programs. He has developed dozens of continuing education courses on respiratory protection, including fit testing. And when we were preparing for this talk, he had hundreds and hundreds of slides to share. So I feel very excited and honored that we have one of the nation's expert on N95 respiratory fit testing here to talk to us today. But before we do that, we're going to take a few minutes and do a poll with you. We are continuing to build out the webinar series for the rest of the year and want to get a sense of the topics that are of most importance or most interest to you. So we're going to start with a poll. Just take a minute or two to fill it out. If you don't see any topics that are interesting to you, feel free to add topics to the chat, and we'll collect them from there. All right, let's wrap up the poll and see what you guys had to say. Interesting. I'll say COVID-19 testing is a hot topic, and stress management. Yes, we are all under a lot of stress. More on donning and doffing is third, and then more about the spread of the virus. Okay, this is really helpful. Thanks for taking the time to answer this poll. So now we are going to turn it over to Dr. McKay. You can ask your questions using the Q&A option at the bottom of your screen throughout his talk. And once he's done, we'll switch over to Q&A and be able to, we'll read out the questions to him and he will answer them verbally. Okay, so with that, Dr. McKay, the floor is yours. Thank you for joining us.
Well, Dr. Brown, thank you for this opportunity to share with you and your group information about respirator fit testing. I'm really excited about this opportunity. I'm going to jump right into it. And although this presentation is about respirator fit testing for home care, I think the very first question that I want to ask or address is what is the basic difference between an N95 filtering facepiece respirator, abbreviated as FFR, and a face mask. So as of May of this year, there are over 500 different N95 filtering facepiece respirators that have been approved by NIOSH, and many more out there, similar types of respirators that are not NIOSH approved. They come in lots of different shapes and sizes, as you can see in this screen here. And then we also have examples of surgical masks. Surgical masks also come in different shapes and sizes, from cup shape, flat shape, duckbill shape, ear loops. And in many cases, they look very similar to N95 respirators, but they are in fact different. So what are the differences between an N95 respirator and a surgical mask? This is fundamental when we get to fit testing. First of all, surgical masks or procedure masks, these are not respirators. A surgical mask is used primarily to protect someone other than the wearer. So we say that they're used for source control. They can provide the wearer some protection, however, against splashes and sprays and coughs and sneezes, but certainly not to the same level as an N95 respirator or another respirator. They may not protect against very small particles such as viruses either. So again, we're talking here about their inability to provide protection for the wearer. They're not generally designed to form a tight seal to the user's face, and they're designed to be used once and then thrown away in the trash after use. So, why conduct fit testing? Let's answer that question. So, here's the reasons why we conduct a fit test for a person that's required to wear a respirator. First, and what most people typically think of, is it helps to identify if a particular make, model, style, and size of a respirator, again, remember we have over 500 different make and models of the N95s, if it will in fact fit that individual's facial features. However, there are other reasons. For example, it's the only known way to actually verify that a person who has been previously trained is capable of properly positioning that respirator on their face to be able to adjust the straps if the straps are adjustable, and or to adjust the metal noseband if that respirator has a metal noseband on it. The other is when a respirator is being worn, periodically the wearer will need to conduct what's called a seal check, which I'll demonstrate later. Now the question becomes, does the person conduct that seal check properly? Well, who better to evaluate that process than the person who administers that respirator fit test? They are the experts in that area. And then during the fit test, there's an opportunity for additional hands-on training. And that training is provided at the time of the fit test. Maybe during the fit test, the person detects leakage. The fit test operator notices it. Then that fit test operator can share with that individual give them some suggestions on how to reposition, adjust the face piece, make changes to improve that fit. And then lastly, the respirator fit test serves as the final exam for the training program. So when we use that fit test as that final, we now feel more comfortable that they will get adequate level of protection when used in the workplace. So since we're talking about fit testing, now the question becomes, are there different types of fit tests? And the answer to that is yes. We categorize these fit tests into two major groups. One of them is called quantitative, and the word quant means number, so we're going to get a measurement. And the other one is called qualitative. So let's show you what these types of fit tests look like. So this screen shows you an example of an instrument that conducts quantitative fit testing. These types of instruments measure leakage into a respirator. So on the right part of the slide, we see an individual wearing an N95 filtering face piece respirator, and the instrument's able to take a measurement of particles outside the respirator and inside the respirator. The respirator is designed to prevent those particles from passing through. Consequently, if any particles are getting inside the respirator, then the presumption there is that they're coming into a leak. And by looking at the number inside the respirator, leakage, to the number outside, we get a measurement of fit. With qualitative fit testing, there are several different types of tests that are available. But if we ask the question, what is a qualitative fit test? It's a pass-fail test that will rely on the subject's sensory response to detect a challenge agent. So some of the types of qualitative fit tests that are accepted by OSHA are shown at the bottom of the slide. One of them is called irritant smoke. Another is banana oil. With the banana oil, it smells like bananas. So if there's leakage, the person says, well, I think I smell bananas while wearing a respirator. With the irritant smoke, we're challenging that individual with a substance which generates hydrochloric acid, so they have an irritant response. They may cough when they detect that leakage. The much more common, however, is the sweetener and Bitrex test, where there's a handheld nebulizer filled with a liquid solution that's either sweet or bitter. The comment I want to make, however, is that not all qualitative fit tests are permitted to be used to fit test N95 filtering face piece respirators. And the reason for that is that irritant smoke, as well as banana oil, can penetrate through the filter material of an N95. Now, since COVID-19 has increased the demand for fit testing, lots of inexperienced people are now offering fit testing services. And I've received lots of reports where everyone has passed fit testing to an N95 filtering face piece respirator, and they were tested with irritant smoke or banana oil, and these methods don't work with that type of respirator, so right away we know that the fit testing is not being conducted properly. So let's talk a little bit about that sweet and bitter fit test. The original fit test kit was developed by the 3M company many, many years ago. And since then, other manufacturers have made their own version of the sweet and bitter fit testing kits. They operate the same way. They just may have slightly different appearances. The way in which the test is administered, however, is in to follow the respiratory protection standard in the mandatory Appendix A. And in that mandatory appendix, OSHA outlines the step-by-step procedures for the saccharin solution, the sweetener test, and then the Bittrex solution, better known as the bitter test. And while they have these two separate procedures outlined in the Respirator Standard, the thing to keep in mind is the test procedures are exactly the same. The equipment is the same. Everything's the same. The only difference is that one solution is sweet, the other solution is bitter. And you can find these if you go to the OSHA.gov website. So let's give you a brief overview of what this test is like. These tests, there are actually two phases, two components to it. The first phase is what we call a taste threshold screening. And the purpose of this is to determine if the subject can detect the taste of that test agent, whether it be the sweet or bitter agent. When this phase 1 is done, we use a weak solution. No respirator is being worn. We put an enclosure over the person's head, and then we spray that weak solution into the enclosure. And then we ask them whether or not they taste it. And then if they taste it within the first 10 squeezes, we record that number as a 10. If it's between 11 and 20, we say 20. And if it's between 21 and 30, we record that number as a 30. Now, this is important for the fit test operator. If the subject is unable to detect that taste, then what we do is we switch over to the other agent. So if you're using sweet, switch to the bitter, vice versa. Or we can't continue, we have to use another type of fit test method. So what I'd like to do is actually show you a video of what this threshold screening looks like. So let me pop up that video for you. What I'm going to do is I'm going to take this enclosure, I'm going to place it over the subject's head, I'm going to have it leaning forward, the enclosure, so that the plastic is not right up against his face. Now I'm going to take the weak solution and I am going to spray the weak solution, but I'm going to ask him to breathe with his mouth open because this is an agent that has a taste response. However, when I do this, I don't want to take the nebulizer with his mouth open and spray it directly into his mouth. It's best to envision where the sealing surfaces are on the respirator and try and spray around the periphery of the respirator. So Glenn, I'm going to have you just breathe with your mouth open. Breathe through your mouth and let me know when you detect a sweet taste. Yep. Okay, so that was 3 squeezes. So what I'm going to do is I'm going to take the enclosure, take it off, and I am going to offer him, I have a bottle of water here and a clean towel. Obviously, if you had a sink or a restroom nearby, but for the video, I'm going to offer him the towel and the water, have him just put some of that water on the towel, and I want to have him rinse his lips and surrounding cheek area to get any residual material off of his face. And then, in addition, you can take the water and take a drink, slosh it around in his mouth, and this is where a restroom is preferable. In this case, it's sweetener. He can go ahead and have a sip and swallow it, or in a restroom, you can spit it out. You may want to prefer, if you were using the bitter agent, you probably would want to spit that out, okay? So now what I'm going to do is I'm going to have Glenn put on Don, the respirator, that he selected earlier. Okay, so I hope that that video was helpful to be able to get a feel for what that threshold screening is like. So Glenn there detected that sweet agent without the respirator with within the first 3 squeezes. So now we're going to proceed to phase 2. And in phase two, what's going to happen is the individual is going to don the respirator. The word don is what we use to mean put the respirator on. The fit test operator will then place the hooded enclosure over the individual's head and instruct the subject to breathe through their mouth. And then, with this strong solution, which is 100 times stronger than the previous weak solution, we'll insert that handheld nebulizer into the enclosure and spray either 10, 20, or 30 squeezes based upon the number of squeezes required to elicit the taste response during that previous threshold screening. And then, because that aerosol is continuously settling down to the ground, in order to maintain that challenge concentration, the fit test operator is going to spray every 30 seconds, spray 1/2 the number of the recorded number of squeezes we used earlier into that enclosure to continuously challenge that face piece. So let me show you a quick video of the strong solution here being used. So I'm going to take my enclosure, I'm going to rest it on top of your head, pop it out so I have it leaning forward a little bit, and the recorded number is 10. So I'm going to begin by squeezing this 10 times. So we entered the threshold screening. We're going to put the threshold screening response. He had 3 squeezes. It is saccharin. I'm going to come over here and hit the fit test tab. So the instructions remind me, make sure that he's donned the respirator, which he's done, that he's conducted his seal checks. The enclosure is over his head. And now to begin, I'm going to hit the start button. And it says to do normal breathing and administer 10 squeezes. First squeeze, 1. Come over to the side, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now at any time, Glenn, if you detect that sweet taste, you let me go. The software says I have 1 more second. It just beep and it says continue normal breathing, but administer another 5 squeezes. So now I'll do another 5. That's 1, 2, 3, 4, 5. So we have 8 seconds remaining, 6 seconds remaining, 5 seconds remaining. When this beeps, now then I'll have you do what's called deep breathing. So it just beep. I want you to take nice, good, deep breaths, and I'm going to administer another 5 squeezes. So that's 1, 2, 3, 4, 5. Okay, so what I decided to do there is to stop the video rather than showing you all of the exercises. But as that testing was continued, OSHA outlines the required test exercises. Each exercise is conducted for 1 minute. So the person would start off by doing normal breathing, followed by deep breathing, as you saw in the video, then turning their head side to side, moving the head up and down, talking, bending over or jogging in place, followed by another normal breathing exercise. The key here is that if the fit test passes, so if we have a good fitting respirator for that individual, the operator will have sprayed a minimum of 75 squeezes of that stronger fit test solution. Since each exercise is 1 minute in length, the total exercise time while wearing that respirator, if it is passed.
Dr. McKay, so sorry to interrupt you during the presentation. A couple of people have said they can't see the presentation. I just wanted to confirm that your screen is shared. I see it. But Nasan, could you just, I'm just going to do a quick technical check because there have been at least 3 or 4 people who said they can't see anything.
Mine says in green, you at the very top, it says you are screen sharing. And then on the right, there's a button that says stop share.
Yep.
I think the slides are visible, but not the video.
Oh, okay, got it. Okay, so when you, if you have any more videos to share, just make sure you, well, I'm not sure. We can figure out, do you have any more videos to share?
Yes, I was going to show the dining procedure and seal check procedure, but I could skip that if that's best.
I don't know, I think you should show it, but make sure to move that video into the, like when you select share screen, you have to reshare your screen to show the video screen. I think that's what you may have to do.
Reshare it. How will I do that?
Stop sharing and then click on, and then click share again, and then you'll see the option that has your video. Then click on the video itself, and we'll try that experiment.
All right.
All right, thank you, Dr. McKay. Sorry to interrupt.
That's okay. All right. So, well, we're going to go ahead and continue here. Sorry for the technical issues that some of you may be experiencing on not being able to see the video, but we believe we may have a solution for that. So, here's a problem. A problem is that nearly all operators who administer errors associated with qualitative fit testing can cause poorly fitting respirators to pass a fit test. In other words, when the test is not conducted appropriately, a respirator doesn't fit, often will pass this fit test. So now the question becomes, how do I know if the fit test was properly conducted? Well, here are the 3 most common errors that cause a poorly fitting respirator to pass. They are: the fit test operator doesn't use the correct number of squeezes, or they don't conduct the exercises for the full length of time. In other words, they don't go for the full 1 minute, or they may be skipping the exercises. And this is a common scenario because when the test is typically done, there is no recording of the results, so to speak. So what happens here is if you have an inadequate cumulative concentration of the challenge aerosol, that will make it less likely to detect a poorly fitting respirator. In the video, you saw a screen where we had a timer going. So I was using something called QualFit software that automates the fit testing procedure. And by using this software, it ensures that all 7 of the 1 minute exercises are conducted with the correct number of squeezes for each exercise at the proper time and in the proper order. So what was shown on the video, if you didn't see that part, in the middle of the screen, it has the test sequence. And so it was saying, for example, normal breathing, administer 10 squeezes. And then down at the bottom of that software screen, there was a timer that would give you how much time was remaining in that exercise, so that the operator would then know when the next exercise was about to begin. So a common question that I'm often asked is, where can I go to get a fit test? Well, the answer to that is to recognize that in your given area, there are many different health and safety companies that routinely provide respiratory protection services, including respirator fit testing. In addition, in your community, you may be able to find an occupational medicine clinic, and there are many of these in your areas. Another way of doing this is to search for experts in respiratory protection. Many of them will be a member of the American Industrial Hygiene Association. And if you go to their webpage, which is the AIHA.org, at the top of that website, you'll see a tab that says Find Consultants. click that tab, put in your zip code. Since they offer many different types of services, select a drop-down menu item that says respiratory protection, and then you'll get a listing of consultants in your geographic area. Another way of finding someone that can provide respirator fit testing services is go to the American College of Occupational and Environmental Medicine website at the acoem.org, and they have a consultants listing also. Instead of finding someone to administer the fit test, you may be curious as to whether or not you can learn, or somebody else can learn, how to administer a fit test. And fit testing courses are offered by a number of different universities and others. Some respirator manufacturers may provide some of those learning opportunities. I happen to have a website that shows a variety of different respirator fit testing courses that are available. There are also videos. I have a much more comprehensive video on qualitative fit testing on my YouTube channel. And for those of you that had technical difficulties and were unable to see the video that I was showing, parts of those were taken from that YouTube video. So let me make a couple of comments here about proper donning of an N95 filtering face piece respirator. When a respirator is put on, what you need to do is you want to place that top strap above the ears and position it over the crown of the head. The bottom strap will go below the ears and around the neck. If you have long hair, you want to make sure that the bottom strap is touching the skin and not laying along the hair. And then if that respirator happens to have a metal noseband, which is very common with filtering face piece respirators, you want to make sure that you use fingers from both hands and progressively use a sweeping downward motion to press that metal noseband along the bridge of your nose. Very important that you don't use one hand and you don't pinch that noseband with an index finger and your thumb, because that will often cause respirator leakage. So you always want to use two hands. Okay. In terms of donning the filtering face piece respirator, you should always follow manufacturer instructions. The reason for that is the instructions can vary with manufacturer and even with different models from the same manufacturer. And since there's over 500 different NIOSH approved respirators, I can tell you whenever I go to a site and I see a filtering face piece respirator that I'm not familiar with, I need to go and look at those instructions because they may be different. So I'm going to try once again. I'm going to show you a video on donning of a filtering face piece respirator. So I'm going to stop sharing here momentarily.
And then share again.
And then hit share again.
Look for the screen with actually you could share your entire screen, and that way whatever you are looking at, everyone can see. Do you see an option? Wonderful. And then go to your video.
I need to click that video.
Yeah, let's see if we can see it.
So now what I'm going to do is I'm going to have Glenn don the respirator that he selected earlier. So I'm going to go ahead and get a respirator too. So he's already received formal respirator training, but I'm going to use this as an opportunity, as a reminder. So the respirator he selected is in this box here. I believe that you brought your respirator with you. I'm going to come in and take out a respirator and just give him a couple of reminders. It doesn't hurt, especially if the person's never been fitted before, to give him more than one opportunity to put it on. So you can go ahead and take your respirator, Glenn, and I'm going to have you hold it. So every manufacturer can have different instructions. In this particular one, you have it placed in the palm of your hand. The straps are dangling beneath it. And then what the manufacturer says, they want you to take the chin and put it in what we call the chin cup, and then reach over, find the top strap, and bring that up and over onto the crown of your head. And then you reach down, find the bottom strap, pull that all the way over your head, over your ears, so it comes beneath your ears, and then along your neck. And then I like to grab the strap and just kind of use my fingers to kind of keep them from getting twisted. It may not be able to be perfect. It may have a slight twist with a filtering face piece. Do the same with the top, grab it by the respirator, and then just run that finger along to try and keep it from being twisted. The key is this top strap should be at the crown of the head. That gives you the maximum amount of tension on your face. Okay, so hopefully we were successful in people being able to see that video.
That was perfect. Thank you.
Great. So key again, once again, is make sure you follow the manufacturer instructions because they can vary from one maker model to another. Now, once you have the respirator on, then the question is, how do I know that I put it on properly? Well, that's what fit testing is for, but we only do fit testing typically initially and then once a year. For the wearer, what he or she will do is conduct a seal check. A seal check is an action conducted by the respirator wearer to determine if the respirator is properly seated to the face. So here's an example of instructions from a 3M Model 1860 respirator, which is pictured at the upper right of the screen. And they say, quote, to check the respirator to face seal, place both hands completely over the respirator and exhale. Be careful not to disturb the position of the respirator. If air leaks around the nose, readjust the nose piece as described in step 3 of their instructions. If air leaks around the respirator edges, adjust the position of the straps and make certain the respirator edges fit snugly against the face. If you cannot achieve a proper seal, do not enter the contaminated area. See your supervisor. So what you're doing here is you're covering that respirator as best you can, and I recommend that you exhale sharply, and if you detect leakage anywhere around that sealing surface, reposition the face piece, adjust the straps if they have adjustable straps, and or remold the metal noseband if it has an adjustable noseband. So what you don't want to do is what's shown on the right part of the slide. What you don't want to do is take the palms of your hand or the edges of your palms of your hand and press the edges against your face. Because if you do that, then you're not going to pick up that leakage. The correct procedure is shown on the left part of the slide where you're covering the front of the respirator, you're exhaling, blowing the air out, and checking to see if you feel any air leaking along the sealing surfaces to get a tight seal. So I'm going to show you, hopefully this video will work. I'm going to show you seal checks for a filtering face piece respirator. I'm going to come over, actually I think what I'll do here is hit stop share. Come down to share screen. So once it's positioned properly, then we'll do what's called a seal check.
Dr. McKay, we can't see the video. Just go ahead and do view your entire screen and try again. So click share screen.
It's share screen.
In the upper left, there should be an option that says share your entire screen. If not, do you see it?
I just see one option for share.
Okay. Okay, go ahead and try again.
So
So once it's positioned properly, then we'll do what's called a seal check.
is that working?
Every respirator,
Yes.
especially filtering face piece respirators, have different instructions by the manufacturer. So for this particular face piece, the manufacturer says that you should use the palm of your hand to cover as much of the face piece material as you can. Don't push in around the edges, so you don't want to do this. You want to cover as best you can. And then you're going to exhale sharply. So it's cover and blow. Although this particular manufacturer with this model doesn't say to inhale, I like to have the person inhale too. So breathe in and blow it out again. So did you feel any air leak anywhere around the ceiling surfaces? Okay, so that's good. So that appears that this respirator may have the right shape and be the right size to fit your facial features.
Okay, so hopefully everyone was able to see that video of seal check procedures. So once again, just want to point out that not only are the donning instructions potentially different from one make and model to another, but so are the seal check procedures. So always follow manufacturer instructions. For example, instructions for the 3M model 1860 differ from a Moldex model 1500. And then instructions can also vary within the same manufacturer for different models. So a 3M model 1860 has different instructions than a 3M model 1870. After the respirator is on, then at some point you need to remove it. Just want to point out that with certain contaminants, such as biologicals, the doffing removal differs from most industrial settings. For example, in healthcare, the straps will be pulled back up and over the top of the head without touching the face piece. And those instructions may not be written in the user guide that comes with the respirator at the time of purchase. And then always wash your hands afterwards, especially if any kind of contact with the face piece should occur. So let me summarize a couple of key points with regard to this presentation. If you wear an N95 filtering face piece respirator or another respirator, make sure you read the instructions and get proper training. Make sure that the respirator is fit tested if it's required to be worn. If it's a qualitative fit test, remember it's going to take some time. There should be, if that respirator passes, there will be 7 one-minute exercises. In addition, if the respirator passed, they will have squeezed that strong solution at minimum of 75 times. Once you have a respirator assigned, you want to conduct seal checks to make sure you have it on properly. The seal checks will be done initially, prior to an entry into an area that requires respiratory protection, and then repeated whenever leakage is suspected. So I want to thank you for attending this video presentation. If you have any questions, feel free to email me at roy@drmckay.com. For training course information on respirator fit testing, you can go to my website. And if you're interested in the software that can be used with the qualitative fit testing that automates the process, that's available through qualfit.net. So I want to thank you once again. I'm going to stop sharing my screen and turn this back over to Dr. Brown.
Wonderful. Thank you, Dr. McKay. That was phenomenal. We're going to go ahead and switch over to Q&A. And so we have a couple of questions here. The first one is, some N95 masks have a one-way exhalation valves without a filter. The person would appreciate your comments on that.
Okay, so traditionally, N95 filtering face piece respirators that were designed to have an exhalation valve were designed for use in industrial settings. And in industrial settings, we're not concerned about the potential contamination of our coworkers. And so the exhalation valve on those types of filtering face piece respirators were designed to try to decrease the heat buildup and decrease at least the breathing resistance when a person exhales. The problem is during this period of a shortage, everyone was scrambling just to find N95 filtering face piece respirators, and they started to recruit respirators from industrial sources, some of which have the exhalation valves. And the problem with the exhalation valve is now you are no longer providing source control. You are no longer providing potential protection for people who are nearby. So if you're in a healthcare setting, if that's the type of N95 that you have, now that person may have to put a surgical mask on top of that N95 filtering face piece respirator to provide source control for coworkers or other people nearby.
Thank you. That's a great response. We have another question. Does the tester need to be certified? If so, where would they go to get certification? I think you covered that, but if you could cover it again.
Well, I kind of did, but didn't. I think the question is actually a very good one because unfortunately, there is no certification for people to become a fit tester. And as I kind of mentioned in the presentation, since COVID-19 broke out, now everybody's a fit tester. Everybody's trying to jump on the bandwagon and provide these services. And if you're not properly trained, like in anything, if you're not well trained, you make mistakes. In this case, the mistakes are commonly allowing a person to wear a respirator that really doesn't fit well, and they pass them thinking, now the person thinks they have a properly fitted respirator, and now they're not potentially getting adequate respiratory protection. So bottom line, there is no true certification. OSHA does say that the person must meet the minimum training requirements, performance requirements that's outlined in their respirator standard, but you are not certified.
Okay, thank you. And what are the costs associated with the testing equipment?
Well, the testing equipment, for the quantitative fit testing equipment that I showed you, which actually does the measurement, that measures particles leakage, that instrument costs approximately $13,000 approximately. The cost of the sweetener Bitrex kits are approximately $150. So there's a huge difference in price. Consequently, most people have gravitated to the qualitative fit testing equipment because of the price differential.
That's great, which brings up this question: how long does the procedure for qualitative and quantitative testing take?
Well, that's a rather complex question in many ways. So if we just ask ourselves on the fit test in and of itself, the fit testing procedure, if we consider the fact that the threshold screening might take, give or take, about 5 minutes, the fit test, which including some time to put the respirator on, conduct the seal check, go through the 7 one-minute exercises, etc., that's approximately another 15 minutes, 20 minutes. So we're talking about 20 to 25 minutes if it's being done correctly. However, there's a lot more to fit testing than just those initial steps. There's a process where you try to identify which make, model, and size is the most comfortable respirator for an individual. They go through a comfort assessment period and other things. So when I schedule fit testing, it clearly needs to be scheduled in at least about a 30 to 40 minute interval for me to conduct a fit test.
Okay, great. There are some questions about There's one question asking for a list of resources for home-based or other community agencies in Maryland. We can save that for follow-up. Do you happen to know resources for fit testing in Maryland?
Not specifically in Maryland, but that's why I provided that link to the AIHA.org, where you can put in your zip code and you can find people who have expertise in respiratory protection.
Okay.
Maybe I can just follow up one other thing about the time there for fit testing. The reason why it says it takes more than just the 7, or typically people will say, well, it only takes 10 minutes to do a fit test. Keep in mind, like with COVID, we have to clean and disinfect equipment. So we have the enclosures that need to be cleaned and disinfected. We have the nebulizers that need to be maintained properly. So there's a lot of additional steps other than just the 7 one-minute exercises.
Okay, that's great. So in one of the earlier videos, actually in the video that people could see, there were 2 different hoods. And so one of the people would like you to describe the need or the reason for the 2 different types of hoods.
Yeah, so typically if I was fit testing a person during this period of COVID-19, I would use the same enclosure for both the sensitivity threshold screening and then the fit test. I use those hoods from my training courses. It just to help demonstrate to a person that's watching that there's a sensitivity phase. So I had the one hood labeled sensitivity screening, and then the fit test phase. So it's labeled fit test. So I have 2 hoods during my training programs. But within a given individual, you'll typically use the same hood. And then if you were testing lots of different people, what you commonly will do is after you fit test an individual, you will clean and disinfect it, wipe it out with an appropriate EPA list and disinfectant, wipe it out. Then it needs some time you keep that material on there for the appropriate time, say 5 minutes while it's wetted, then it has to dry out. So if you have other people at fit test, you may want to have other hooded enclosures. So while one is being disinfected and then subsequently drying out, you can go on and do another person with a 2nd, 3rd, or 4th hood.
Okay, wonderful. So in a long-term care or retirement community facility, who is required to be fit tested? Is it every department, or is it a requirement really just for the clinical staff?
Well, that will be determined by the employer. So the employer has the responsibility to identify which people are required to wear respiratory protection. Once that employer identifies who is required to wear respiratory protection, then OSHA makes it very clear if you're required to wear a tight-fitting respirator, such as an N95 filtering face piece respirator, then that person must be fit tested.
Okay, perfect. Is there a difference, or what is the difference between the N95 mask and the KN95 mask? Is the KN95 just one of the different types of FFRs?
Okay, so a KN95 means that it is a filtering face piece respirator that probably was manufactured in China and passed the regulatory requirements for approval in China. Their testing is similar in some respects, but not quite as stringent as the NIOSH approval process. So when available, you want to select a NIOSH approved filtering face piece respirator. During the times we have these emergency procedures in place, when we cannot get access to a NIOSH approved N95 filtering face piece respirator, now OSHA will allow an employer to use other respirators from other countries where they have some other approval process. It may not be exactly the same as ours, but it's something better than having something that doesn't go through any kind of formal testing.
Okay, that's a great response. There are 2 related questions about, one questioner said that they couldn't purchase fit testing kits because it was out of stock in every company and website. Do you have any recommendations? And we can cover that. And the second related question was, what if you can't get a fit test for an N95 respirator? What are other respiratory choices? Let's pause there and then I'll ask the rest of the question afterwards. So what do you do if you can't get the fit testing kits?
Yeah, so the fit testing kits, the suppliers, like everything else, became unavailable. Those are starting to come back up to speed. So now it depends on, well, what are you running out of? If it's the enclosure, for example, the hooded enclosure, the dimensions of that enclosure are in the Respiratory Protection Standard. And what some people have done creatively is they have taken, you might be familiar with people that wear for hazmat suits. They have hoods that are used for hazardous materials operations, and they've cut off the top of the hood to use that. The nebulizers are another issue. You need to purchase those nebulizers. There is no substitute for those nebulizers. You need to be able to get them because they have very specific characteristics in terms of particle size, etc. The latter question, I kind of forgot it. You want to remind me?
Sure. They were asking for a recommendation for where to find and how to purchase the test kits because they had run out of stock on every company website that the person could find.
Well, I think that was really the first question. I think now I recall the second question. So I mentioned the first question was you may be able to use the hoods from personal HAZWOPER suits to create a replacement hood or more hoods. The question is, if you can't get the N95 filtering face piece respirator, there are other respirators that can be used, and those would be an elastomeric half mask respirator, which has a rubber sealing surface. Those are generally more available, and in addition, there are also powered air purifying respirators that have both loose and tight fitting face pieces that also offer higher levels of protection. And if those are not available, elastomeric full face piece respirators could be used. So when N95 filtering face piece respirators are not available, there are other types of respiratory protective equipment. All of those other types of equipment even provide higher levels of respiratory protection.
Okay, great. There was a question about the medical evaluation prior to the fit test and some expression of challenges with small faces, fat cheeks, and flat cheeks, and facial features that the questioner has problems with when doing fit tests. Okay,
so if facial features, this is not a medical clearance issue. If people have all kinds of different shapes of faces, and so the N95 filtering face piece respirators in the early days when I first started fit testing, there was really only one or two, so you had very limited choices, and they only came in one particular shape and or size. Now there's over 500 different make and models of a wide variety of facial features and shapes. So your fit tester, if he or she is experienced, they can look at an individual and sometimes right away say, well, this particular face piece here that everyone else is using, I don't think this one's going to fit you well. Let's go over to this other model. Of course, the problem we have with COVID is these other alternate models are not necessarily always available either, and that's part of the dilemma.
That's helpful. Thank you. Two related questions. How long can the N95 respirator be reused? And do we need to do fit testing for KN95? And just a note to the attendees, because there's so many questions, we're actually going to allow the webinar to run past noon. So you're welcome to stay on, but if you aren't able to stay on, we understand. So let's hear what the responses are to fit testing for KN95 and reuse of N95 respirators.
Okay, so if you're going to be wearing a respirator to protect yourself, you want to make sure that it fits. That's the purpose of fit testing. So the KN95 respirator should be fit tested. So I think that answer is pretty clear. Yes, it should be fit tested. It's being used as a surrogate for when a NIOSH approved N95 is not available.
And reuse of N95s, how long can they be reused?
Yeah, so the only published research at this time that talks about the reuse is studies that were conducted by NIOSH, and in those studies, they successfully showed that a respirator can be used, a filtering face piece respirator like an N95. Many different models, several different models were tested, and what they shown is that they can be used successfully for 5 donnings. After 5 separate donnings, then the success rate on the fit tests began to decrease and became unacceptable. So part of that reason has to do with you're continuously trying to mold commonly that middle band. And so 5 is the published number that is most often referred to.
Okay, thank you. Dr. McKay, since SARS-CoV-2 is considered a pathogen transmitted through the droplet route via aerosolization, what is your recommendation for qualitative tests for home-based services? I can read, should I read the whole thing again? It's a lot.
Yeah,
Okay.
if I understand it, and then you can correct me, Dr. Brown. So they're making a statement that the virus that causes the disease COVID-19 is exhaled from individuals by both droplet, large sizes, and then there's also concern that it is also able to infect individuals through the airborne route, meaning very, very, very small particles. So the fit test is independent of the infectivity aspect of it. The fit test is, there's no virus around at that time. You're simply using a test agent to verify that you're getting an acceptable seal to the face. So when you use a saccharin kit or a Bittrex kit, or you're using a TSI port count, for example, to do quantitative fit test, the filter material at the time of the test, in this case an N95, is designed to be able to stop that test agent from penetrating through the filter. Therefore, the concept is if the person tastes the material, sweetener or Bittrex, then you have excess leakage. Or in the case of the quantitative fit test, if you measure particles getting into the face piece, then you have excess leakage. So we're looking to see that the respirator fits. Something that people should keep in mind is that and this is one of the things I teach in fit testing, all respirators leak. Even respirators that pass a fit test leak. The purpose of the fit test is to help select a respirator that has the best fitting characteristics for an individual, teach them how to put it on, how to position it, but all respirators fit. When the contaminant is a concern, so let's say you have higher levels of exposure to a biologic agent. When you have higher levels, now what you need to do is go to a higher level of respiratory protection. So when you have like aerosol generating procedures with higher potential levels of that infectious agent, whether it be SARS-CoV-2 or any other biological agent, now with those higher potential levels, you go to higher levels of respiratory protection.
Okay, perfect. We have employees who have asthma and COPD and have difficulty wearing the regular masks and the N95. They explain because of the asthma, they cannot wear the mask for more than a few minutes. Any comments on how to support these employees?
Yeah, so lots of people have asthma, lots of people have COPD and or other cardiopulmonary diseases. So that's one of the reasons why we do respirator medical clearance before a person is fit tested to identify who these people are. And they should be screened out. But sometimes even then they don't uncover the difficulty when they put on a tight-fitting respirator. So there are other types of respirators. And when a person is unable to wear, say, an N95 filtering face piece respirator, then what one does is one will look at alternative respirators. The most common choice would be what's called a loose fitting powered air purifying respirator. And that is a respirator that uses a blower unit to pull, think of it like a vacuum cleaner in some respects. You're sucking the air through a filter and then cleaning that air up and then pushing the clean air through a tube and delivering it into a face piece that could have either a loose seal or tight seal. And by pushing that clean air into the face piece, we call it a powered air purifying respirator. And the motor is now taking over the work of the heart and the lungs. So breathing resistance essentially becomes zero, and dead space, which is the buildup, causes buildup of carbon dioxide, essentially becomes insignificant. And so now all of the physiologic cost of wearing the respirator is essentially eliminated by that blower unit. But they are more expensive. So they cost anywhere from $500 to $2,000, in some cases even more. There are newly designed emergency use powered air purifying respirators that are much lower in cost that are now becoming available. And they are an alternative for people that have either physiologic problems trying to breathe through a tight fitting face piece, as well as being available for people who are unable to wear a tight face piece because they have facial hair.
It's like you read the mind of the final question. It's the person asking the final question. Bethel Home Healthcare wants to know, is wearing a beard an issue when using an N95?
Yes, it is. So, yes. So, yeah, I anticipated that question. I get it all the time. I've done this before. So, so let's make sure we're very clear here. So sometimes if an N95 is being worn solely for source control, and so you go out in the general public, you see a lot of people wearing, they have a beard, they may have on, instead of a face mask, they may be using an N95. We're trying to conserve N95s for people that really need it, like healthcare workers, but we still see them out there. If they have a beard, then that N95 can be used for source control. However, in a situation in which that individual needs to protect themselves, okay, then an N95 filtering face piece respirator or any respirator that's intended to have a tight seal cannot be worn with facial hair. And trust me, if you have facial hair, it is going to leak. You may still pass your seal checks. If seal checks were good enough to detect all leakage, then we wouldn't have to do the fit testing. So seal checks help you identify positioning and placement of that face piece, but they're not as accurate as fit testing. And trust me, if you have facial hair, you're going to get leakage.
That's a great point. There are two more questions, and those are going to be the final two questions. First, Dr. McKay, what is your recommendation on fit testing of personal care assistants who work in patients' homes? And I'll give you both of them at the same time. And the second is, for a nebulizer treatment in the home setting or medical office setting, if we have a proper fisted N95, is that an acceptable respirator? So if you don't remember the second one after you answer the first one, I can repeat it. But let's start with, what's your recommendation on fit testing of personal care assistants, so home health aides, that work providing hands-on care to older adults and people with disabilities in their homes?
Okay, so I think what needs to be done here, this really goes beyond the scope of my expertise. I assist in this area, but every scenario is different. So someone is going to need to make an assessment, when is respiratory protection required? And when it's required, then you need to wear that tight-fitting N95 respirator that's been fit tested. There may be scenarios where you go into an environment where, because of, you may be able to maintain social distancing, maybe that person's been continuously tested and been negative. Maybe that person has been self-quarantined for the appropriate length of time. Maybe that person, it has very low risk of having COVID-19. And in that case, maybe the respiratory protection would not be required. So this becomes an assessment that you first have to determine, is respiratory protection required? If it's required, then you must be fit tested.
Dr. McKay, I can help with that. We had a speaker last week who specifically talked about the use of PPE in home care and what kinds of protective respirators the personal care assistants should use. And so the message that was communicated very clearly was that everybody might have COVID, and the intimate nature of providing care as a personal care assistant means there's a risk of exposure. And so N95 respirators are recommended for personal care assistants, and therefore, following up on what you've said, therefore fit testing is required for the use of N95 respirators by personal care assistants in patients' homes.
So I would defer to that other individual for that. For example, I'll relate back to the industrial environment. When I go into an industrial environment, the contact person will say, do I need to wear a respirator? And I say, well, I don't know that. Someone needs to do a hazard assessment. Someone else needs to make a professional judgment as to whether or not respirators are needed. You tell me what the exposure is and the level of contaminant, and then I can tell you what type of respirator to use. But that requires that hazard assessment. And so you have another individual, if they believe that that the respiratory protection is required, you go with that answer. Once you have that answer, it's required, then it must be fit tested.
Great. And then the final question, for a nebulizer treatment in the home setting or medical office setting, if we have a properly fitted N95, is that an acceptable respirator?
So there's different, so by nebulizer treatment, I'm assuming that you're giving something such as, we're not talking about aerosol generating procedures on a patient. We're talking about something perhaps like an albuterol treatment
Yes.
for an individual. So in this case, that person they're breathing from a nebulizer for that medication, and then their exhaled breath is going back out into the room, and now the risk of exposure would be exactly the same as if they were not getting that nebulizer treatment. But if that nebulizer treatment is inducing cough, now you may have potentially a higher risk. So again, I'll default back to that other person's expertise. When you're going into that home environment, they need to make an assessment. What are you doing? And then based on what type of procedures you're doing, whether or not that respirator would be required.
That sounds like an excellent way to close. Kimberly, yes, we will send out the link to the recording and slides from all the previous presentations when we send out the link for this presentation for Dr. McKay to everyone who's both attended and registered for the webinar. I'm really impressed by the volume and sophistication of the questions. Really fantastic job, audience. Dr. McKay, you've been phenomenal and patient. And just for those of you who didn't get to see the videos, the links to those videos will be in the presentation and slides, and so you can follow through and watch them on your own. I had a couple of closing slides, but essentially they were all going to say, thank you, Office of Preparedness and Response. Thank you, Minka. Thank you, Emergency Preparedness Network. We are excited to continue with this webinar series, and we're so grateful that you participated. Dr. McKay, the Maryland and DC home care community is very lucky to have you. Thank you, everyone. We're gonna wrap up at 12:14 p.m. Take care.
Thank you so much.
Thank you.